Good afternoon, I'm Dr. Thaddeus John Bell. I was just sitting here browsing through an old medical book. It was written in the 1930s. I'm impressed with the amount of information that we now know that was not in this medical book 50 years ago. I want to talk to you today about the ABCs of diabetes. A. Your A1C, a very important diagnostic test that you will need to get done at least 3 to 4 times a year. If you have diabetes and your doctor has not gotten an A1C, mention the A1C to him. That is the only way that we know that your diabetes is under control. And if it is under control, it decreases your risk for complications. B means high blood pressure. Hypertension is very common in people who have diabetes. You want to make sure that your blood pressure is at the prescribed goal. The prescribed goal for most diabetics is 130/80. You want to make sure that you're on medications to keep that diabetes under control. And remember, you have to take the medications every day in order for the medications to work. C. Now this is a new one for most folk. Most people do not understand that if you are diabetic, it is probably very likely that you will have an abnormality in your cholesterol. Either your good cholesterol or your bad cholesterol. In other words, your HDL, which is the good cholesterol, could be too low. So you'll need to be on medications to raise that. And if your LDL, which is the bad cholesterol, is too high, then you'll need to be on medications to lower that. Sometimes we can give one pill to control both, but you will need to be concerned about your cholesterol. D. We have to always be concerned about the diet. I rather use the word meal plan because most diabetics will have to be on a meal plan for the rest of their lives in order to keep the diabetes under control. And of course, the next one is E, and E is for exercise. Exercise is medicine. It's very, very important that you exercise for the rest of your life if you're diabetic. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.